Hi, my name is Chris Kemmesat with Mountain View Medicare Insurance, and today in our final part about Medicare, we're going to talk about the differences between Original Medicare, Medicare Advantage, and Medicare Supplement. We're going to compare and contrast them, kind of talk about benefits and the cons to each of them, and then we're going to talk about what your next steps are. First, let's talk about Original Medicare. Pros to Original Medicare is you can see any doctor that accepts Medicare, and most doctors in the country take Original Medicare. There's no networks, like I said. The cons to it, it's the unlimited liability. With Original Medicare, you have a 20% liability after you meet your deductible, and there's no limit to it. So if you have a bad year, it can get really bad. Moving on to a Medicare Advantage. The advantage to a Part C, or the Advantage plan, is you're joining a network. This is coverage that you're used to and you're comfortable with a major insurance company. With an Advantage plan, you're going to get additional benefits. These benefits are Part D prescription drug coverage is included, which makes it cheaper than Original Medicare. There's also a max out-of-pocket limit to the damage that can be done, the amount of expenses that you have in a year as far as medical coverage is concerned. These plans also come with additional benefits. You can find Medicare Advantage plans that will give you money for over-the-counter medication. There's plans out there that offer dental, vision, hearing coverage, free gym memberships. These are all included in a lot of these plans. Medicare Supplement. With Medicare Supplement, this is the Ferrari plan that we talked about. So I call it a Ferrari because if you have underlying health issues or medical issues, or if you're just healthy and you want to have good insurance, that G that we talked about is a really good plan. After you meet your $233 deductible for the year, when you see or receive care, there's no additional cost. So you're paying that monthly premium to ensure there's no more medical cost. So with a supplement, you have the same thing with the networks. You can see any doctor that takes Original Medicare. You don't need a referral, and after that deductible's met, covered 100%. Now, to compare and contrast, maybe the Advantage plan, can't decide between that or the supplement. I like to call it this way. An Advantage plan is pay as you go. There's set costs outside of seeing your primary care doctor. There's set copays that you pay for your services. You pay a set amount each time you go in, and if you don't go, then you're saving money. With a supplement, you pay even if you don't use it. You're paying for that insurance, you're paying for that peace of mind. Each person's different. If you've got the extra money or you need the coverage, the supplement's the way to go. If you're looking for a cost-effective plan with excellent coverage as well, the Advantage plan is the way to go. One of the last things I want to say when I'm comparing and contrasting plans, the Advantage plan is popular, it is growing every year, and a lot of people are moving toward Advantage over Supplement now. But what I do want to say is, if you're healthy now, one thing you need to consider is it is guaranteed issue a supplement when you turn 65, and if you down the road get sick, we can't get you back into that supplement. So that's a decision. The first thing that you need to decide is, do I want to be on a supplement or do I want to be on an Advantage plan? And if you do want to be on a supplement, we move down one path. If you want to be on an Advantage plan, we move down another. That's the first and most important decision to make. And the last benefit to Medicare Advantage is you can switch plans every year during open enrollment. So if you're with a plan, you're unhappy with them, that's not a major issue. We can switch you the following year. If you've got new concerns that have come up medically, we can move you within the same insurance company to a plan with a potential small premium to give you additional coverage with lower copays and lower max out-of-pockets. There's a lot of freedom in these plans. When with a supplement, you're selecting that plan, and likely you're going to stay with that supplement the rest of your life. I understand Medicare is complicated, and I'm here to help walk you through this process and make it as simple as I possibly can and help you understand it. I do want to tell you again, there's no charge to you to work or hire a broker like me to work for you. I'm looking to build a relationship. This isn't a one-sale business. This is you working with a broker the rest of your life, and that's the relationship that we're trying to build. Feel free to reach out to me. I'd love to set up a meeting, talk to you, and answer any additional questions you may have.